Have you ever felt like something is not quite right inside your body, but no one has been able to clearly explain what it is? A small sensation, yet deeply irritating. Not painful, but impossible to ignore. And the more you try to get rid of it, the more it keeps coming back. Before we go any further, I want you to do something simple. If you have ever experienced thick mucus in your throat that just will not go away, if you constantly feel the need to clear your throat for no clear reason, if it feels like something is always stuck there no matter what you do, go ahead and press the like button right now. Not just for this video, but because it means you are finally ready to understand what is really happening inside your body. And what you are about to hear today may completely change the way you see this problem. Now imagine this. You are sitting quietly, maybe at the dinner table with your family, or alone in a calm, silent room, and suddenly, you feel it, that small urge in your throat, a subtle pressure that tells you to clear it. You try to ignore it because you do not want to interrupt the moment, but the more you ignore it, the stronger it becomes. Eventually, you give in. You clear your throat once, then again. You swallow. You take a sip of water. Maybe you cough lightly, and for a brief moment, it feels like it is gone. But then, it comes back. It always comes back, as if something is sitting at the back of your throat, refusing to leave. Let me ask you something honestly. How long has this been happening to you? A few weeks? Several months? Or has it quietly followed you for years? Because if your answer is more than just a few weeks, then what I am about to share with you might finally give you the answer you have been searching for. Here is the mistake almost everyone makes. They assume this is a throat problem. Some believe it is coming from the lungs. Others are convinced it is simply allergies. And many people accept it as a normal part of getting older. But here is the truth. In many cases, all of those assumptions are wrong. This problem does not begin in your throat. It is not rooted in your lungs. And chances are, it is not what you were told the last time you visited a doctor. The real cause is hidden somewhere completely unexpected. And once you see it clearly, everything will finally start to make sense. My name is Dr. Weston, and today we are going to talk about a condition that affects millions of people, especially those over the age of 50. A condition that is often misdiagnosed, frequently misunderstood, and almost always treated the wrong way. So stay with me, because the most important part is coming very soon. Now let us be honest with each other. You are not someone who simply ignores this. You have tried things. You have made an effort. Maybe you have had warm ginger tea, or honey mixed with lemon. Perhaps you have used throat lozenges from the pharmacy, or tried steam inhalation to clear your airways. Some of you have gone to a doctor, and you received different answers. Allergies, post-nasal drip, stress or anxiety. Some of you were even given medication, antihistamines, nasal sprays, or other treatments that sounded convincing. And maybe they helped a little, just a little, but never enough to truly solve the problem. Because no matter what you try, that thick, stubborn mucus always finds its way back. Does that sound familiar? It feels like you are constantly managing it, but never actually fixing it. And there is a very important reason for that. Everything you have tried so far is focused on the symptom, not the root cause. It is like wiping a wet floor over and over again, without realizing there is a slow leak behind the wall. You can keep cleaning forever, but until you fix the source, nothing will truly change. And today, we are going to uncover that source. Before we go deeper, I want to hear from you. How long have you been dealing with this constant throat mucus? Write it in the comments. I read every single one, and your experience might help someone else realize they are not alone in this. Now let us talk about what is really going on. When people feel mucus in their throat, the first assumption is that it is coming from the nose, the sinuses, or the lungs. And yes, sometimes that is true. A cold can cause it. Seasonal allergies can trigger it. Dust or pollution can irritate your airways. But there is one key difference between temporary mucus and something more serious. A cold usually goes away within 1 to 2 weeks. Seasonal allergies improve when the season changes. But if you have been dealing with this for more than 4 to 6 weeks, if there is no fever, no clear pattern, no obvious trigger, then you are likely dealing with something completely different. And this is where things become very interesting, because what I am about to explain is something most people never hear about. Even after multiple doctor visits, the real cause behind this persistent throat mucus, especially in people over 50, is often something called silent reflux. Now I want you to pay close attention here, because this is where most people get confused. When people hear the word reflux, they immediately think of heartburn, that burning sensation in the chest after eating. But silent reflux is not like that at all. In fact, many people who have it never feel any burning in their chest. Not once. That is why it is called silent. It does not announce itself the way you would expect. It works quietly in the background while you go about your life. And by the time you notice something is wrong, it is already affecting your throat. Now let me show you what is actually happening inside your body. And I want you to picture this as clearly as possible, because once you truly see it, everything we talked about in the first part will suddenly connect. Inside your body, your stomach is not just a simple organ that holds food. It is more like a powerful chemical chamber, a place filled with strong digestive acid designed to break down everything you eat. This acid is extremely effective, but also extremely aggressive. Now, between your stomach and your esophagus, which is the tube that carries food from your throat down into your stomach, there is something very important. A muscular valve. Think of it like a one-way gate. It opens to allow food to enter your stomach, and then it closes tightly to keep everything inside where it belongs. Under normal conditions, this system works perfectly. Food goes down. Acid stays in the stomach. Nothing comes back up. But here is where things begin to change. As we get older, and as certain habits build up over time, that valve can start to weaken. Not suddenly, but gradually. So gradually that you would never notice it happening. During the day, when you are standing or sitting upright, gravity helps keep everything in place. So you may feel completely normal. No warning signs, no obvious symptoms. But something very different happens when you lie down. And this is the part most people never realize. When you lie flat, gravity is no longer helping you. And from that slightly weakened valve, it is not always a large amount of acid that escapes. Sometimes it is something much more subtle, a very fine mist, an invisible vapor, so light that you do not feel it at all. But make no mistake, it is still acidic, and over time, it begins to travel upward, slowly rising through your esophagus, until it reaches an area of your body that is not designed to handle acid at all. Your throat, your voice box, the delicate tissues that allow you to speak, swallow, and breathe comfortably. Now here is the critical difference. Your stomach is built to handle acid. It has a thick protective lining, but your throat has no such protection. So when this acidic mist reaches your throat night after night, it creates a gentle but constant irritation, not strong enough to cause pain, but enough to trigger a reaction. And this is where your mucus comes in. Your body is not making a mistake. It is trying to protect you. When your throat senses this irritation, it responds by producing a thick layer of mucus. Think of it as a protective shield, a barrier designed to defend sensitive tissue from ongoing damage. So that mucus you are constantly trying to clear is not the real problem. It is actually your body's attempt to solve the problem. But here is the issue. You keep clearing the mucus, but the irritation is still there. So your body produces more, and the cycle continues over and over again. You clear it. It comes back. You clear it again. It returns even thicker. It feels endless because you are treating the result, not the cause. But what I am about to tell you next is something very few people ever hear, and it explains why this problem can feel so persistent and so difficult to fix. Inside your stomach, there is a digestive enzyme called pepsin. Its job is to break down protein in the food you eat. Inside the stomach, it is incredibly useful, but outside the stomach, it becomes a problem. When silent reflux happens, pepsin does not stay where it belongs. It travels upward along with that acidic mist. And when it reaches your throat, it stays there, quiet, inactive, almost like it is waiting. Now here is the surprising part. Pepsin does not need a large amount of acid to become active again. Even small amounts of acid from everyday foods can wake it up. That morning coffee, a glass of orange juice, tomato-based meals, sparkling drinks, even things that seem harmless can trigger it. And when pepsin becomes active in your throat, it starts breaking down protein. But there is no food there. So what does it act on? Your own tissue, very slowly, very subtly, but consistently. This creates tiny amounts of irritation, again and again, and your body responds the only way it knows how, by producing more mucus, more protection, more buildup, and now you are stuck in a loop that continues until the root cause is finally addressed. Let me share a real story with you. A patient I once worked with, a woman named Margaret. She was 67 years old, retired, and completely exhausted by this problem. For nearly 2 years, she felt like there was something stuck in her throat at all times. She described it as a small object, almost like a ball, that would not go away. She had visited multiple doctors. Each one gave her a different explanation. Allergies, postnasal drip, even anxiety. She tried everything they recommended. Medications, home remedies, humidifiers, special teas. Nothing worked. When she came to see me, I listened carefully to her story, and certain patterns became very clear. Her symptoms were worse in the morning. Her voice sounded slightly rough when she woke up. She slept completely flat on her back every night, and every morning, she drank a glass of orange juice, believing it was helping her health. Once we addressed the real cause, things began to change, not overnight, but steadily. Within 6 weeks, she told me something she had not felt in years: relief. Her throat felt clearer. The constant sensation began to fade. And most importantly, she finally understood what had been happening all along. If what you are hearing right now feels familiar, if you are thinking, "This sounds exactly like what I have been experiencing," then take a moment and press the like button, because there are many people out there silently dealing with this, and they need to hear this information too. Now we come to the part that truly matters, because understanding the cause is powerful, but knowing what to do about it, that is what creates real change. And I want to give you a plan that is simple, practical, and something you can begin applying starting today. Not next week, not someday, today. Let us begin with the single most important step. This one change alone has helped many people notice improvement faster than anything else. Elevate your upper body while you sleep. Not just your head, your entire upper body. This is where many people make a mistake. They stack pillows under their head, thinking it will help, but this only bends your neck forward and can actually make the problem worse. What you need instead is a gentle incline, your whole upper body raised at an angle. You can do this by placing something stable under the legs at the head of your bed. Solid blocks, thick books, anything that creates a lift of about 15 to 20 centimeters. This allows gravity to work with you while you sleep, helping keep stomach contents where they belong. For some people, a wedge-shaped pillow can also help, as long as it supports your entire upper body, not just your head. If you do nothing else from this video, start with this tonight. Now let us talk about your sleeping position. Try sleeping on your left side. This may sound simple, but it can make a real difference because of the natural shape of your stomach. Lying on your left side helps keep stomach contents lower and further away from that weakened valve. If you usually sleep on your back or on your right side, try switching to your left side for a few weeks. Observe what happens. Your body will tell you if it helps. Next, we need to talk about timing, because this is one of the most overlooked triggers. Avoid eating before lying down. Give your body time to digest, at least 2.5 to 3 hours before going to bed. Do not eat anything. Not even small snacks. When you lie down with a full stomach, you increase the chances of that acidic vapor moving upward. But when your stomach is mostly empty, there is far less pressure and far less risk. This one habit alone can create a noticeable shift over time. Now let us focus on your evening meals. Keep your dinner light and simple. Heavy meals take longer to digest. Fatty foods stay in your stomach longer. Large portions increase pressure inside your stomach. All of these factors make reflux more likely. Instead, choose lighter options in the evening. Lean protein, soft vegetables, moderate portions. Save heavier meals for earlier in the day, when your body has more time to process them while you are upright. Now we come to something that may surprise you. Certain foods that seem harmless may actually be making your symptoms worse. Be mindful of trigger foods. Some of the most common ones include coffee, alcohol, carbonated drinks, chocolate, mint or peppermint, citrus fruits and juices, tomato-based foods, spicy meals, deep-fried or greasy foods. Now this does not mean you must eliminate everything forever, but here is what I suggest. Try a simple experiment. For 3 to 4 weeks, reduce or remove these foods, then observe. Pay attention to how your throat feels. This is not about restriction. It is about understanding your own body. There is one detail here that often surprises people. Peppermint may make things worse. It feels soothing in the moment, but peppermint can relax the valve between your stomach and esophagus, which can allow more reflux to happen. So peppermint tea, mint candy, or mint gum may not be helping the way you think. Instead, some people find gentle alternatives more helpful. Chamomile tea, fresh ginger tea, not as a cure, but as part of a supportive routine. Now let me give you a simple technique you can use in the morning. A gentle gargle to reduce irritation. Take a small amount of baking soda, about 1/4 to 1/2 teaspoon. Dissolve it in a glass of warm water. Gargle for about 30 seconds. Then spit it out. Do not swallow it. This can help neutralize the acidic environment in your throat, especially after a night of exposure, and may reduce irritation over time. Next, let us talk about hydration. Drink water consistently throughout the day, not all at once, not in large amounts during meals. Instead, sip water gradually between meals. This helps keep mucus thinner and easier to manage. At the same time, avoid overfilling your stomach with liquids while eating, because that can increase pressure and worsen reflux. There is one more factor that many people overlook completely, and that is stress. Manage stress as part of your healing. It may not seem connected, but your body does not separate physical and emotional stress. Chronic stress can increase acid production. It can also affect how well that valve functions. So taking time to calm your system is not optional. It is part of the solution. Simple things can help. A daily walk, quiet breathing, spending time with loved ones, moments of stillness. These are not small things. They are powerful. Now I want to share something important. This information is here to guide you, not to replace professional medical advice. If you are taking medication, do not stop without speaking to your doctor. If your symptoms continue despite making these changes, please consult a healthcare professional. There are tests that can confirm what is happening and support you further. Let me bring everything together for you. The mucus in your throat is not the true problem. It is a response, a protective reaction to ongoing irritation caused by silent reflux. That irritation is happening quietly, often while you sleep, and until the source is addressed, the cycle continues. But now you understand the real cause, and more importantly, you have a plan. Start tonight. Elevate your sleeping position. Give your body time to digest before lying down. Be mindful of what you eat. Support your body consistently. And most importantly, be patient, because real improvement happens over weeks, not overnight. You have been dealing with this for a long time, and you deserve clarity. You deserve a real explanation, and you deserve a path forward that actually makes sense. If this video helped you understand what is happening in your body, write in the comments, tell me your experience. You might help someone else feel less alone. And before you go, Subscribe to this channel and turn on notifications, because there is so much more you need to know to take control of your health. And I will be here to guide you. I will see you in the next video.